We're so excited to have you on our HIPAA Compliance Managed Medical Virtual Assistance webinar. Thanks for joining us, guys. Hello. We're going to allow everybody an opportunity to get into the meeting here. Take a few minutes as everybody comes on to the presentation. If you wouldn't mind, could you please mute your microphones for right now? Just make sure you're muted and on mute. We're going to be talking about HIPAA today, HIPAA compliance and managed medical virtual assistance. So if you've had ideas or thoughts, do I want a VA? Should I use a VA in my practice? This is a good webinar for you. Appreciate everybody coming on. Hello, hello. I see Amy, Mauricio, Alex, David, Carrie. Yeah, I see you guys hopping on here. Thank you very much for joining us. Thank you for hopping onto the webinar today. We're going to give everybody just a few minutes to get into the webinar and get an opportunity to kind of get situated. We got a lot of information we're going to cover today, and this might be one of the most impactful webinars you watch, not just from managed medical virtual assistant standpoint, but on HIPAA compliance in general. We're hoping that you take away a lot of information today. We got a lot to cover. So if you have a notepad, right now is the time. Grab that notepad, grab that pen. I like to date my notes and put a date at the top of the notes. That way I can refer back to when I learned something. I also like to, whenever I hear something really important, I like to put a little star or asterisk next to it. You guys do whatever you do in order to get the information that you need today. But those are some tips and things I like to do. So again, we're going to be talking about HIPAA compliance and managed medical virtual assistants. And if you have considered virtual assistants or thinking about virtual assistants, we got a couple more people jumping on here before we get started, so give them a little bit more time. But if you've been thinking about a virtual assistant, or this is something that you're like, how does that work? How can we utilize a virtual assistant and still be HIPAA compliant? Well, we're going to talk all about that today. You're going to learn a lot of information. We have got a jam-packed presentation. We got a special guest. And you're gonna love to hear from this special guest and what this special guest has to say about HIPAA compliance. This special guest happens to be an expert in HIPAA compliance, so I'm glad that he's going to be able to join us today on this webinar. So thank you guys for joining us. I did see Kansas Sparks. I see Kansas that you popped on. So it's good to see you guys. It's good to see you guys. We are going to get started here and we're going to move ahead, but we're going to move ahead with some introductions to still give people some time to get on that are thinking about getting on. So if you have people in your practice that need to be on, you can still share the link with them that you received and they can hop onto this webinar as we're going through the presentation. So that will give you plenty of time as we're doing the introductions and stuff. They're not going to miss too much if you send it now, but you got to send it right now. So let's get started with some introductions here. First, let me introduce Mike Yablonowitz. Mike, are you there?
I am here.
Hey, Mike, what's up, man?
How's it going, Nathan? Very excited for this.
So tell everybody about what we're going to learn and who you are.
Well, first of all, good afternoon, everybody. It's a beautiful Thursday. For all those who don't know me, my name is Mike Yablonowitz, and I am the president and CEO of BBC Global Services. BBC Global Services is the preeminent leader in HIPAA-compliant business process outsourcing. Today, I'm super excited to provide information on one of the hottest topics when it comes to staffing in the healthcare space. This is related to privacy and the handling of the information. We here at BBC Global are diligent in maintaining a HIPAA-compliant workforce and environment for our clinician partners. What this means is not only do we find the proper people to aid your practice, but BBC's managed solution ensures that the handling of any patient information and communication are done in a HIPAA-compliant manner. Based on the feedback we've gotten from a lot of our clients and partners, we felt it was important to spend a little bit of time discussing not only what this HIPAA thing is all about for many of you, but what are the things to think about when hiring to limit your exposure to liability. To help share this information, we have the privilege of having Matthew Desjarny on the webinar, who works with digital compliance. Matt currently serves as a compliance consultant with expertise in corporate compliance, training, and procedures. Digital Compliance is the company who, for lack of a better term, is our control to ensure we are handling this process properly and are up to date with this ever-evolving compliance. Without further ado, I want to bring on our MC, our VP of Sales, and Chief Ambassador, Nathan Bush. Nathan, take it away, buddy.
Thanks, Mike. I appreciate the opportunity to share HIPAA compliance and medical virtual assistance with everybody today. So thank you very much for that warm introduction. I'm Nathan. I am the Vice President of Sales for BBC Global Services. And let me tell you, because first thing, we're going to cover a number of things today. We're going to cover introductions. We're going to cover our free giveaway. Yeah, we do have some free stuff to give away if you stay till the end. Review of HIPAA. We're going to cover 5 main categories of HIPAA. We're going to cover the 4 steps to ensure HIPAA compliance with your vendors and our 13-point no nonsense HIPAA security protection. So we're going to cover all that stuff today, but let me introduce myself just a little bit and give you a little bit of my background. I have worked in the medical industry for a while now. Last 4 years, I was with a medical device organization. We started that organization. We had 7 locations, and we were doing about $2 million in revenue. With the help of BBC Global Services, which is why I'm here today, we were able to scale that operation from 7 locations to over 40 locations. We went from 2 million in revenue to over 20 million in revenue. And I can't tell you enough how important there was a consumer-facing B2C medical device organization. I can't tell you how important it was to be able to utilize BBC Global Services to scale our call operations and our medical tasks that we needed to do behind the scenes. And so maybe if we have a little bit of time in this webinar, depending, because there's a lot of information to cover, I will get a little bit more into that story in some of the ways that we utilized BBC Global Services. So without further ado, like Mike said, we want to make sure we get through all the introductions. And Matt, I'd like to bring up Matthew DeJarny. Matt is with HIPAAtraining.com. He said digital compliance, but HIPAAtraining.com is the website if you're interested and you need more information from Matt about this. Matt has got 5 years with HIPAAtraining.com and over 25 years of medical compliance experience. Hi, Matt, and welcome to the webinar here with us.
Hey, Nathan, thanks for having me.
Yeah, thank you. Why don't you tell everybody a little bit about yourself and your background?
Yeah, you bet. I'm retired Navy, retired in 2007. I've been on a journey in the medical industry from my days as a hospital corpsman, where I served on the battlefield and on various surface ships along with the Marines, 15th Marine Expeditionary Unit, 3rd Marine Division. And that's where my compliance journey started. And through a series of happenstance and interesting stories, I ended up working in OSHA compliance and then in sexual harassment and HIPAA compliance. And I find myself today working with digital compliance, who owns HIPAAtraining.com. And I'm stoked to be working with you guys today.
Yeah, thanks very much, Matt. We'll bring you back in just one second. But before we do that, guys, because Matt's got a lot to share about HIPAA, do me a favor and turn off the distractions for just 1 second at this point. So I gave you an opportunity to send the emails to your team members who wanted to participate. Now let's turn off the distraction. And if you're watching this on replay, I totally appreciate the fact that you're trying to get the education, because I know, and what research has shown is that people that attend webinars like this or listen to webinars like this, and those that are here live watching the webinar like this, you guys are leaders in the healthcare industry. And so what leaders do is they take charge, and I'd like you to take charge over the next 45 to 60 minutes of your own education. So let's learn, let's grow as leaders in this space. And speaking of leaders, one leader in the healthcare industry is Dr. Pardeep Medtu. He's a board certified oculofacial plastic surgeon. He's incredibly talented and pretty renowned around the country and what he does. And Dr. Medtu had this to say about BBC Global Services here. Rose, that's his virtual assistant, follows the same protocols we use in the office. We have an efficient process that allows us to respond quickly and offer her guidance if needed, but we're at the point where she's very independent. She asks the right questions and can identify potential problems so they can be addressed proactively. Now, Dr. Pardeep Medtu is a leader in the health space, making sure that he follows the proper rules and regulations and laws like HIPAA, which is why he employed BBC Global Services. And he worked with us and created this gift that we're going to give away if you stay till the end. The gift is the Medtu method, and this is a way to onboard virtual assistants into your organization and ensure that those virtual virtual assistants learn the policies and procedures within your organization and then grow their knowledge with your company. In fact, this gift is so important because it doesn't just work for virtual assistants. The Med2 method actually works to help with any remote employee and make sure that they're following the tools and getting productive within your organization quickly. So if you stay till the end, Dr. Pradeep Med2 put this together, and he's given us the availability because he is a leader in the industry to give that to you if you hang on till the end. Now, speaking of leaders, all right, everybody that's on this call, if you're on this webinar, you are a leader in the healthcare industry. We already talked about that. In this screen, it's blank. What it represents is all the dreams that you had when you started your healthcare practice or when you started working in the healthcare industry. And some people over time, for whatever reason, become discouraged from dreaming in the healthcare industry by others. Other people become a challenge that take their dream away from them. Other people are hindered by disappointment and past hurts. My dad told me when I was about 12 years old that disappointment is really the gap between expectation and reality. We have an expectation of here, but in reality, we get this. And so that keeps us from being able to do the very things that we want to do and starts to squelch that dream that we have within us. And some people get in the habit of settling for average. Well, that's really a problem. See, because when you settle for average, Maureen Dowd says this, when you settle for less than you deserve, you get even less than you settled for. And that's not what we want as leaders in the healthcare industry. And so she's a New York Times op-ed columnist. She's one of those people that I love to read because she's got such a positive attitude and positive leadership skills. And so we know you're leaders. You lead in life. And when you lead in life, let me explain something about HIPAA and being a leader. Leadership is very similar to brushing your teeth. Simon Sinek says, when you brush your teeth consistently over long periods of time, you have a healthy mouth. The problem is when you stop doing it for just a little bit, you get this decay that starts to happen. And eventually those teeth start to rot. And it gets to the point where it becomes painful. HIPAA is very similar. We got to do this and we got to care for this each and every day, which is why I know that you're a leader in the healthcare industry, because you want to make sure that your HIPAA policies and procedures are accurate, they're correct, and you're doing them correctly in your practice, along with hiring vendor partners that do HIPAA correctly, which is why we're going to talk to you today about HIPAA. I kind of look at HIPAA and character in a very similar stance. Matt, what about you? What is HIPAA?
Yeah, that's a thrilling question. And I say that with a chuckle because there's a market presumption of what represents HIPAA compliance. We get calls all the time. As a matter of fact, when you guys first called, you were asking questions. I understand that there's testing and training involved. I understand that there's a lot of information we have to go through. What do I need to do to be compliant? And I wish there were a magic button that you could press at BBC Global and you could say, boom, we are now HIPAA compliant, because there are standards and they are measurable. And with assistance, which is what I do all day, every day, you can have somebody pretty easily take you to a place of HIPAA compliance. But from that point forward, it's not over. You've got to go through your policies and procedures. You've got to read through them and make sure they represent your daily operations at work. And you've got to make sure that your staff is trained, along with a list and litany of a dozen other things. And it's not a lot of work, but it's regular work. So I'm going to have to agree with you on that.
Yeah, I mean, HIPAA is basically protecting people's private health information. And if you don't think that that's important, look, at BBC Global Services, we take this seriously. This is a serious issue for us. And so it's not something that we look at passively. It's something we look at actively, which is why we put this entire webinar together. We brought on one of our consultants that we bring into our organization. We're sharing that resource with you. So don't take this lightly. Take notes today. We've got lots of information we're going to cover. And the first thing that I'd like to cover with you, Matt, is why is HIPAA compliance so important? I'm sure you have plenty of horror stories, but why, I mean, just in general, why is HIPAA so important?
I'm going to lead with an atypical answer, Nathan, and I'm going to say it's so important because the regulation comes from the federal government. So the presumption might be, hey, it's important because it's a rule or a regulation or a set of laws, or it's codified in the Code of Federal Regulations. But that's not the case. I think that despite the force of law, it's important because you have to know where you're walking so that we don't step on a mine. And that sounds like the enforcement arm of HHS is coming to get us. And that's not necessarily the case, but it's because of things like a general clause that appear very frequently in federal regulations, which says, even if, speaking of horror stories, I'm not required to be fully HIPAA compliant, does that mean that I cannot then receive penalties or regulatory actions on my company? And that's not the case. I mean, of course, you would think if you were not required, and these case studies appear in our training. But as one example, I have personally worked with a 501c3 organization that had nothing to do with HIPAA regulations, and yet I have to help them through an audit because through a series of unfortunate circumstances, they did end up with stored PHI, and now an organization that requires no compliance whatsoever is falling under the regulatory arm, thinking they're perfectly safe. We want to avoid that by being wise. And so HIPAA compliance is important for your protection. But as we're going to cover, I think, later in this webinar, just having everything in order doesn't mean you're protected. And so what we have to be as leaders is proactive and go around checking the locks and checking the windows and making sure that we're doing our due diligence to make sure that a slip up on somebody else's part does not become a catastrophic problem.
For sure, for sure. Other than following policies and procedures, I don't have much to do with the orchestration of HIPAA within our organization, but I kind of look at HIPAA like this. My wife and I and daughter at home, we have a pool. And that pool requires care, constant care, every week. Every week we're doing something to the pool. We're emptying the skimmer basket. We're putting the chemicals in the pool. We're shocking the pool to make sure that the issues get taken care of quickly. Because here's the problem. If I don't take care of that, if I don't nurture it and follow the proper pool practices, my pool will turn green. And if I don't do something about that immediately, then it could be catastrophic on the system, and it costs hundreds of thousands of dollars in order to be able to replace those issues that get created from not taking care of that pool on a regular basis. And I kind of feel the reason HIPAA is so important is it's just like that to the healthcare industry. Is it's something that you have to take care of daily, weekly, monthly, to ensure that these issues don't pop up. And if you put the right practices in place, then it just becomes routine and it becomes a habit of part of the way that you operate your business. So since HIPAA regulations frequently refer to, Matt, electronic communications, what type of media falls into this category of electronic communications?
Yeah, that's such a funny question, because if it's electronic and we can pass information across it, this webinar, for example, if we wanted to pass PHI across this webinar, then this falls into that category. That includes our telephones, that includes our computer communications. It covers texts and emails. It covers faxes. Even though the fax feels like a physical media, it's being transmitted on one person's end electronically. So it covers literally anything that receives power and can transmit data.
Fantastic, fantastic. Thank you for that. Yes, I appreciate that very much. And I'm sure everybody here on this call does too, knowing that if you're transmitting private health information, if you're sending it from one location to another or storing it, that requires that you're following HIPAA protocols with that information. So leading into healthcare, which we're talking a little bit about today, because I know that if you think about HIPAA from this standpoint, HIPAA is leadership in the health industry. Let's equate HIPAA to leadership, because I know that the subject can be dry. And so I want to make sure that we're interjecting why we're practicing good, solid healthcare practices and policies, is because this is what makes us leaders, guys. This is what builds trust over time. And so leading into healthcare requires making the right decisions and managing those decisions daily. If you don't, Matt, I was talking to you just the other day about some of the horror stories of fines and penalties from HIPAA, from people not following these policies and procedures. When you don't follow the rules, guys, here's a tip. Here's a business tip that I've learned over my years. When you don't follow the rules, when you don't play within the laws, and you do it long enough, it will eventually catch up with you no matter what. So do the right thing. So Matt, tell us a little bit about some of those cases that you were telling me about.
Yeah, I don't want to turn this into a grotesque display of sorrow. I'm going to say that when it comes to a case-by-case basis, people misunderstand that first line. It says right there on that slide, fines of up to $50,000 per violation and up to $1.5 million per year. Let me throw some bookends on that. There is a set of special situations which can increase that $1.5 million per year to virtually unlimited. For instance, I worked with a religious diocese who got themselves into a pickle. And of course, they cover a whole sector of the nation with their charitable services. They literally told me over the phone, well, you know, the fines are only $50,000 per violation and up to $1.5 million per year. How many violations could this result in? Literally every disclosure. So if somebody's singular record gets out through a mishandling of, let's say, an old PC hard drive. It was supposed to be set for destruction. It didn't. Somebody sold it to a friend. Somebody walked off with a spare because they needed one for their computer at home. There was no managed process for guaranteeing that data that came into the facility did not come out of the facility. And then we end up with a single health record. That is not a single disclosure. That's a single disclosure per item, which could be diagnosis, piece of personally identifiable information, healthcare plan, insurance information, and then per device or per transmittal from a singular device. And the technical language goes on and on. And in this particular case, they had to settle for, and I would just say, well over $1.5 million in a year. That is not typical. That is not typical, but we have to take it very seriously because we're not paying close attention to what HHS takes seriously, and there's special language they have in there and what identifies a disclosure and what's a violation. And so we take it very seriously. And the only reason, and let me just say this, I'm going to go off script for about 3 seconds. The only reason that Digital Compliance agreed to participate with BBC Global is not because we have a sales partnership or a revenue sharing plan. We were going to originally say no. Because we don't do this. We don't advertise, we don't sell lists, we don't buy lists. We are a destination organization, and we're very good at what we do. We agreed because on reviewing the process that BBC Global put themselves through, which went above and beyond typical minimum standards for federal compliance, our organization leader said this is actually an important enough issue since the pandemic, and this issue being using remote communication means electronic, using remote bodies and personalities to manage PHI has become such a citable issue. It's getting hit more and more often upon review during audits that we need to get the information out there so that people can take the steps to prevent this, very simple steps to prevent these exposures. And BBC Global is not our only business partner that engages in services like this or similar to this, but they are, and I promise I wasn't prompted to say this, they are our best example of compliance in this organization, this organizational structure, right? So we're, having gone off script, I want to tell you guys I'm proud of the work you've done, and I'm excited. I hope that you end up helping a lot of people with this.
Well, thanks, Matt. I really, I mean, it's breathtaking for us to hear because we want to make sure we do the right thing. And so it just fills my soul with joy when I hear you talk about the fact that we're doing the right thing in the industry. With that said, I'd like to say hi to a couple of people that jumped on. I saw Natasha here. I saw Sonia here. So guys, thanks for joining the webinar with us. We got a lot of information still yet to cover. So you haven't missed too much other than learning a little bit about what are some of the consequences of not following HIPAA and where those pain points are if we don't do it. So you can go back and watch the replay if you missed the beginning of this, if you're joining in the middle of the presentation here. So by the way, you might feel a little bit like Brick from Anchorman here. I don't know how to feel. Like who's responsible if there's a HIPAA violation? And so here's BBC Global's position on that in this specific situation. In the event of a breach, responsibility typically falls on the covered entity, the healthcare provider, and the business associate. So that's the company that is also utilizing the private health information. According to HIPAA regulations, both parties must take appropriate steps to mitigate any potential risk and report the breach to the necessary authorities. The covered entity is responsible for notifying the affected individuals, the Department of Health and Human Services about that specific breach. In some cases, guys, there may be also a need for information that needs to go to the media, unfortunately. The business associate, on the other hand, that would be like your vendor relationships, they're responsible for notifying you, the covered entity, and assisting in any investigations and remediation efforts. So if you're wondering like who's responsible, this is it. Both parties may face penalties for non-compliance depending on the severity of circumstances of the breach. It's crucial for both the covered entity and the business associate to have clear agreements in place detailing their responsibilities, processes, and how they're going to handle potential breaches of information to ensure compliance with HIPAA. Matt, from a HIPAA compliance standpoint, who's responsible in the event of a breach?
Yeah, that was a succinct summary. I'd like to focus on something though. Imagine on a piece of paper, you've got a blank sheet of paper, and I ask you to draw a line from the top of the page to the bottom of the page, and then I say the top of the scale is the person most culpable, the person most responsible, the organization most responsible for any consequences of an unintended breach, and then a person who's the least responsible. And we pick people who act. We pick the actors. We say the covered entity, which we also refer to as the organization. We say the business associate, which is not those people who work for us. Those are our agents. Business associate is typically a third-party organization that provides us a service, regardless of their size. And then I say, now I'm going to give you 4 or 5 people, and you arrange them from top to bottom who you think, just for giggles, who would be the most responsible if there is such a thing. And really, the only thing that matters is at the top of that line, you put the covered entity. That doesn't mean that everybody else is not responsible for their mishandling. It means that at the end of the day, the responsibility that the covered entity takes upon itself for the management of an individual's PHI is paramount. It is the reason the industry exists. The covered entity could be a care provider's office, but is just the primary source where PHI comes in. And so if I am the covered entity, regardless of how many or which of my business associates farther down the line have an issue, maybe they caused the breach, I am ultimately responsible. And I think we're going to hammer on this a few times. I'm not just responsible to the industry. I'm not just responsible to the compliance enforcement arm of HHS. I'm responsible to the individual whose information I disclosed. And BBC Global has always made a big production, and it's funny from the perspective of a compliance consultant, because we don't typically get that much passion on the phone. We get people who are looking to meet minimum standards. Can I just get compliant? Really, I've got a ton of other paperwork to do, and it's relatable. But it's exciting to see something that's important to me and I've taken on as a career to become so important to one of our customers.
Well, yeah, we found that there's advantages with HIPAA compliance. And so we listed out some of them here on the screen: protecting private health and security information of patients. That's a benefit. Number 2, maintaining patient trust. We don't lose the patient's trust, nor your trust as a healthcare provider. We also found that you can avoid penalties for non-compliance. So that's a benefit of HIPAA compliance. Promoting the best practices for data protection. We get an opportunity to present on HIPAA compliance. So we find that as being a leader in the industry and being able to promote those best practices offers benefit to our organization and improving the overall reputation of the organization. I hope you guys are finding how trustworthy the HIPAA compliant aspect of our medical virtual assistants are within BBC Global Services. So I put together this, I call it the 5 main categories of HIPAA, the Pentagon of HIPAA, right? So here it is. Here's what HIPAA is. I mean, you've gone through the trainings before, the HIPAA trainings. You know that it's about privacy, security, transaction code sets, unique identifiers, and enforcement. For the purpose of this presentation, we're going to move quickly through this because you already should know this information. However, we're not going to focus so much on transaction code sets and unique identifiers because this particular presentation is designed around privacy, security, and enforcement. We don't work too often in transaction code sets and unique identifiers other than what we're directed to by the clinics that we work with. So with that said, privacy, regulations, and its purpose. We know that privacy regulation and its purpose is broken down into 2 different things: the patient's rights and the responsibility of the covered entity. Matt, why is privacy so important to HIPAA? Why did the federal government put this together?
Privacy is the first protection we have in place. It's the first thing that gives us credibility to our patients. It's the guarantee, and it's a social contract, even though it's got the force of federal law behind it, that we are going to make every reasonable effort to protect patient data in its physical form. We're going to limit access to it. And then we're going to make sure that though we are authorized agents of that information, you're allowing us to manage your health information, that we also are following our own internal standards and federal standards to make sure that nobody else, to include those people with no authorization in our own organizations, have access to that information.
Perfect, perfect. And so I wanna ask the audience a question. Put it in the chat, kind of your answer to this question that's on the screen here, so that we can make sure that in case you have questions towards the end, if for whatever reason you can't come off mute, you want to type a question, I want to make sure we have access to that too. But type your answer to this question in the chat. On a call back to a patient to remind them of their appointment, if there's no answer, can we leave a message? Simple yes or no in the chat would be fantastic. Can we leave a message on their answering machine, their voicemail, when their next appointment is? What's your answer in the chat? Yes, no, maybe, I don't know. What's your answer? Put it in the chat. I want to make sure the chat's working for you guys so you can ask questions later on. If they're using Spruce, I love that answer, Carrie. I love that answer. Spruce is a HIPAA compliant partner with us in that they work to do HIPAA compliant messaging with their patients. So great plug for Spruce there. We really appreciate the relationship there. Matt, so what is the answer? Can we leave? We got answers coming in. No, no, yes, some answers here. Yep. So what is the answer?
So the quick answer is yes, but it is a qualified yes. And the two quick qualifications, your no may not be wrong. It may be a policy of your organization. You may have literally been trained by your organizational standards not to leave a message. However, as far as HHS is concerned, which is to say the HIPAA regulations, you may leave a message, but you must have authorization from the customer or from the patient to disclose that information onto a voicemail. And typically that appears on an intake form on your disclosure permission, where they sign off and say, would you like anybody else to have access to your information? Can we tell your appointment status to a spouse or that sort of thing? One of those questions is typically, may we leave you a voicemail? And if that answer is yes, then you've met 50% of the qualification for a yes. The second half is you must be as vague as possible. It is industry best practice, though not codified in the regulations themselves, to call and just sweetly and generically state, this call is for so-and-so. This is from your healthcare team. It's regarding an appointment. Please give us a call. We haven't identified the patient. We haven't disclosed any PHI, and we haven't disclosed, importantly, the name of the practice, because if you call a single person with nobody else in the household, and we can tie their name or their identifiers to a practice, then assumptions can be made, and that's considered PHI. That's a great question, by the way.
There's an episode of New Girl for those of you that have watched that show. I know that my wife and I have watched that from time to time. There's an episode of New Girl where the OBGYN calls and lets the cat out of the bag. Like, I couldn't imagine a more drastic example and violation of releasing private health information that you're not supposed to. Now, they left it with a person, which is even, I mean, I don't know which is worse, answering machine or to a person directly, but still, like, you got to be smart about HIPAA. You got to take it seriously, and you got to have policies and procedures in place in your practice to ensure that that doesn't happen. Now, again, we got to move quickly. We're already 31 minutes into this, and I want to be honorable of your guys' time. So HIPAA is also about security. We want to make sure that that here it says the purpose of these regulations are to prevent unauthorized access, use, and disclosure and destruction of electronic health information. So what are some of the main requirements of security standards, Matt? I know that you talked to me about 4, and those 4 are information, physical security, audit trail, and digital signature. Any information that could help the clinics on the call here or watching?
I'm going to tell
replay?
you, I'm going to give you the shortest and most useful answer I can give you for this. Don't look at these blurbs as interesting one-liners. While we're paused and I'm chatting, take a note, take a screen cap, whatever you can do. These are the primary areas you need to ask whoever you're consulting with. It could be your practice attorney. You might have a compliance officer who's a master at getting access to this information. Ask these specific things to the person or the persons who are helping you put together your policies and procedures, the person you can call who can answer your questions about best practices. Can we do this? Is this okay? This happened. What should we do? Take all of this information and say, okay, so I know information system security is important. What does it mean? How do I do it? Let me tell you what we do now. Do I need to do anything else? That's going to be the most useful way to sort of mine this information out of somebody who knows what they're talking about and who'd be happy to help you with that. That's what I do every day. That's what our whole team does. And if you've got a professional that you can reach out to now, they would love to discuss this with you. And there's no better way to do it than to just sit on the phone for 30 minutes and talk it out.
I'm going to take a second too and just briefly touch on physical security. This is so important, especially in today's environment. When your people are working from home, is that the proper physical security of private health information? I'm not going to answer that on this call. I'm going to leave it up to you to answer that question. I'll tell you this. All of our agents work in our offices for medical virtual assistants. They work in our offices, and I got 13 points of no nonsense that we're about to go over with you that's coming up on what we do in order to maintain private health information. However, you got to answer that question for yourself. Is working out of your house protected? Do you have the ability to protect private health information? So transaction code sets, Matt. This is simply just making sure we have a standard set of codes. Anything that they need to know for this webinar about transaction code sets?
No, not a significant amount. However, they deal with them all the time. It's just typically being handled by their medical biller, their insurance company, or in some cases, whoever manages their Medicaid payments. That would overlap with 42 CFR Part 2. I say that for the benefit of those people who have substance abuse, disease treatment centers or services. And the most important thing I could say about that is that their transaction and code set regulations are what directly affect your interoperability compliance. Now, if you're not a Medicaid biller, then that's not going to be important to you. But if you are, this could affect up to 25% of your Medicaid payments if you're non-compliant with code sets.
For sure. So we want to make sure you're compliant with code sets. Unique identifier, this was the number assigned to you so that you can file for those claims with Medicare, Medicaid, and also the health insurance. Enforcement, there's two parts to this. Enforcement part of the law is obviously the investigation and the audits. So with enforcement, the goal of enforcement within HIPAA regulation was to ensure that all covered entities within the HIPAA regulations protect the privacy and security of private health information. And so the real question then becomes, how can you ensure protection? Well, maybe more along this lines. Maybe you are protected in your organization, but how do you know that your vendor, your outsourcing company, how do you know if they're monitoring HIPAA compliance? Well, let me tell you, there is 4 things that we have found that will help you button up and ensure better HIPAA compliance with your vendors. These 4 things were helped orchestrated by Matt's company, and so we're very much appreciative of the HIPAAtraining.com organization, Digital Compliance, that has helped us put these 4 things together. So here they are. The first one is a signed business associate agreement. A signed business associate agreement. You got to have it. Number 2, a HIPAA readiness checklist. What do you do to police yourself internally? Number 3, HIPAA certificates and confidentiality agreements. And then number 4, policies and procedures. So let's go through each one quickly. A BAA versus terms and agreements. So there is a difference. A business associate agreement should be offered by you, the provider, to your vendors. That is what the law says, is that you should be giving it to the vendor and saying, here's our business associate agreement. Terms and conditions are just the terms and conditions of the agreement with your vendor. And so with BBC Global Services, we ensure protection with the healthcare clinic by making sure we sign a BAA with you. So we have it, we provide one for you if you don't have one already, and we'll sign yours, that's no big deal. But we make sure that you sign a business associate agreement and terms and conditions when you do business with us. Anything specific about business associates agreements that are so important, Matt?
I'm just going to reiterate what you said, and that is, it's an ideal that as a covered entity, I am providing the business associate agreement to my business associate, and that's some vendor downstream from me. It's not a legal requirement. I mean, if in fact you don't provide and you just begin doing business, and you would say, I would never do that, of course, because you're familiar with HIPAA standards, but fully 60-70% of our organizations don't understand this premise. And so here's what happens. There's nothing fundamentally wrong with receiving a totally reliable and healthy contract from a business associate that they ask you to sign. But the reason they're doing that is because the relationship has not been covered by the protections offered in the contract. Now, when I don't offer it and I quickly sign one that comes from my business associate, and I'm going to repeat this, that's not fundamentally a problem, especially if you have a trusting relationship. But I have lost control of the contractual language. And remember that the purpose of the policies and procedures are not just to protect the PHI, but it's also to protect the organization. And so the recommendation suggests that all contracts and all handshakes start upstream and head downstream. Other than that, you nailed it. Great job.
Fantastic. So a HIPAA assessment, readiness assessment. I'm sorry, guys. I wanted to be able to cut this up and pop up a bunch of different these questions so that you could see them. So I know that this is small, but let me just take a second and walk through this with you. This is our readiness checklist, and this is something that we police ourselves with in the organization. So number one is that business associate agreement. That's the first thing on this checklist, and we make a determination if we need one, if there's going to be private health information that's transacted with our organization. That is a medical virtual assistant. Number two, workforce training, making sure that we do all of the trainings necessary within our organization and we have them on file. Internal systems, policies, and procedures. Are we ready with your internal systems, policies, and procedures on a regular basis? Subcontractor and contract agreements, unauthorized disclosures, accounting for private health information. How do we do that within our organization? Do we need to do that within our organization specific to the account? And we look at this to make sure that we're ready. We also look at the availability of records. If for whatever reason, God forbid, we needed to provide it to Health and Human Services, we have that information readily available on how we did and what we did. Unauthorized disclosure of PHI, breach of insecure PHI. So do you have a readiness checklist? Does your vendor have a readiness checklist? That's a good question to make sure that you are protecting private health information with your vendor. Next thing here, the HIPAA certificates and confidentiality agreements. We can provide as soon as your specific virtual assistant gets done with their HIPAA training, as we onboard them, we provide you with a copy of that HIPAA certificate and their confidentiality agreement. We have those on file for you. So that's another way to ensure HIPAA compliance with your vendors. And then lastly, Matt's organization has been so kind to take the time to help us develop over 30 different policies and procedures specific to HIPAA, working with private health information. And like those 10 there are samples that you see on the screen right there, accounting for private health information, what to do in the event of data breach, computer system. Can your vendors talk to you about their policies and procedures within their organization as it relates to HIPAA? Anything around those four things that they need to know, Matt, that I did not cover?
No, and you hinted at a really important detail. So the only thing I'm going to say about that is if you're not able to have a basic conversation about, hey, we're interested in doing business with you, how do you guys account for PHI disclosures? If there's a stutter or a pause, or they want to redirect you, it might be because they're sales. And you get into a conversation with the person who identifies themselves as a compliance officer, and they can't have a basic conversation with you about their policies and procedures, about the actions they would take. That's a red flag. And so you do a little homework. The fundamental rule to protect yourself in HIPAA compliance is the phrase due diligence. I did everything that I could reasonably do, and it shouldn't be intrusive on your day-to-day operations. I did everything I could reasonably do to identify that they did in fact have policies and procedures in place, and that they did in fact follow their own policies and procedures. And then that is the golden approach. Even in an audit, where the assumption would be there's an audit, I'm in trouble. And that is not the case. As many auditors walk away with no recommended action other than internal administrative changes as there are those that come away with financial penalties. You truly can prepare for an audit, and there's nothing to fear as long as we're following due diligence.
Perfect. Thank you very much. Isn't Matt fantastic at HIPAA compliance? He really knows his stuff, and I can't tell you how appreciative we are of the relationship on how he helps us stay buttoned up and remain HIPAA compliant. So thanks, Matt. I really appreciate having you on this webinar. If you'll hang on till the end, Matt, we'll maybe have you hang around and answer some questions if people still have questions as we come to the question phase.
Nathan, I want to say one quick thing.
Yeah.
Quick thing about Matthew is it's important to know that he is one of the main reasons why we're comfortable doing this, because as you all, everybody knows, I need to make sure anything I do is done correctly and properly in any of the vertical markets that we support. And Matt not only makes me feel comfortable, right, and his company to be able to offer this service properly. And anybody that has any questions, I don't know if we're doing this later, I ask you to reach out to Matt. He's a wealth of information and he knows everything about this topic. And it's the reason why, like I'll say before, why I have the confidence and the comfort of offering these services to our clients and our partners.
Yeah, thanks, Mike. I appreciate you with that interjection because we all feel that way in our organization. So thank you very much. In our organization, we were talking a lot before we got on this webinar to present to you and to give you the information, whether you're watching live or on replay. And we were thinking about like, how can we make HIPAA a little bit more palatable? Because we know it's not the most wet subject, it's a little dry, and so that's okay. But we tied it to leadership and leading in your industry. And I felt compelled to add this this quote here from Michael Hyatt, the author of Vision Driven Leader. He's a leadership expert, and he said, if you have a clear vision, you'll eventually attract the right strategy. If you don't have a clear vision, no strategy will save you. So what is the BBC Global strategy for HIPAA? Here it is. Here's the 13-point no nonsense HIPAA security. If you're taking notes, this is a good thing. You can check yourself against these things in your own organization. We have a core value in our organization of communication. And so we want to communicate transparently with you and show you these 13 things that you could do in your organization that we've done in our organization. We find that communication is the act of giving, receiving, and sharing information. So that's what we're doing here on this webinar. Let me share this with you. So number one, a firewall was installed to protect against unauthorized intrusion. So that's the first thing we did. Number two, a virus detection system was implemented, including procedure to ensure that the virus detection software is maintained and updated. So we made sure that we had the proper firewall and virus detection in place. The next thing that we did was we restricted the use of the internet over our network. It's not permitted for personal use. And we also made sure that all systems required a valid user ID and password, and that those users are not permitted to allow other persons or entities to use their required user ID or password, smart card, or other authentication information. We also, in our 13-point no nonsense HIPAA security checkup here and policies and procedures in place, we make sure that users log off of their system before they go to lunch or take a break or leave for the day. We want to make sure that they are logged off of their system, and our system will log them off if they don't do it when they're supposed to. In fact, all terminals have a password protected screensaver that will log them off automatically after 5 minutes of inactivity, or log them off the system after 15 minutes of inactivity. So they'll be booted off the system if they're not active on their screens, and they'll be locked off their system to the screensaver if they haven't been 5 minutes away from their computer. All users are required to change their passwords after every 3 months. We also decided that after 3 unsuccessful attempts of a specific password, the user ID will be suspended and reset by our system administrator. This is how we control that private health information so that nobody has access to the information they're not supposed to. Upon termination of an employee, all passwords for that employee will be immediately changed or deactivated. We also made sure passwords would be changed immediately in the event of a suspected or actual password breach, and all mobile phones are stored in a locker to prevent unauthorized use. Remember I said earlier, if you're working from home, can you be HIPAA compliant? Well, one of the things that we've taken pretty drastic measures on is that our team members, when they come into our offices, they lock their mobile phones in a storage locker and they can get them on breaks. So that's how we police that. Also, the office is locked where the workstations are contained when not in use. So there you go. So that's our 13 points. We also have a couple of HIPAA security officer, HIPAA compliance officer. David Justice is our HIPAA security officer. He's a VP of operations. He's actually on this call. I appreciate you being here to listen in, David, to our HIPAA compliance training. Amy Cohen, our Director of Engagement, is also our HIPAA compliance officer. Nick Ancho is a HIPAA compliance officer in our offices in the Philippines. And Albert Yoshida, our country manager in the Philippines, is our HIPAA technology officer. So we have these 4 pieces in place also to ensure HIPAA compliance for you. So people will get to this part if I'm talking about HIPAA compliance with them one-on-one, and they'll ask me the question, so what is a medical VA? What do you actually do? And so let me make sure I break that down for you. We provide you with a dedicated full-time staff member. That full-time staff member follows your policies, they follow your procedures, they work as though they're a remote employee of your organization. However, we have a managerial backbone to support you and them. That managerial backbone can participate and listen in on trainings. They can offer assistance and guidance, and they work to make sure that your campaigns are running the way that they're supposed to. We track time of that employee working on your campaign, which means that there's no ancillary charges with BBC Global Services. You only pay for the time that the employee worked. We also provide you with a daily report of productivity. So when you sit down with the BBC Global Specialist expert and they go through what tasks and what types of things are going to be done by this employee, how are the calls going to be measured, that type of stuff, that helps us to be able to formulate these key performance indicator reports that you will be able to have access to on a daily basis. And what's really cool about these reports is you can adjust them by the day, the week, the month, of the year to kind of get additional information and insights into your organization and the productivity of your company. And then lastly, BBC Global has put together this integrated leadership model specifically for these medical VAs, meaning that you work directly with your employee for coaching, training, feedback, however the employee would do it in your organization, guys, is the way that you would coach them to do it when they work with BBC Global's medical virtual assistant. You have direct access to pull up a message, to direct message, whatever your messaging system is, to have those conversations and to make sure that your employee is getting the feedback. You can pull up the camera and do a Zoom meeting or do a Google Meets meeting in order to make sure that your employee is getting the feedback that they need in order to be successful working within your organization. They're your full-time employee. They just happen to be managed, tracked, supervised, and overseen by our organization. And those employees within that are contained within a HIPAA compliant framework. So that's how BBC Global Services works. And remember, I told you, if you stayed till the end, hung in there till the end, the leader in the industry, one of the leaders in the industry, Dr. Med2, put together that Med2 method. Just hang in there. We just have a couple more minutes to get through of information. And if you are a leader in the industry, then here's what I would say. Leaders know the way, go the way, and show the way. John Maxwell wrote the 21 Irrefutable Laws of Leadership, probably his most known book, and he said, leaders know the way, they go the way, and they show the way. One of the leaders in the healthcare industry is Mark Plonner. I know this because Mark came to our organization and asked us to figure this medical VA situation out. He was one of our initial customer in this medical VA space. And we said, if we're going to do this, we're going to do it correctly. And so we contracted with Matt Dorjani's company, HIPAAtraining.com, and we ensured that we put the proper policies and procedures in place from the very beginning. And here's what Matt had to say about working with his virtual assistant. Wormley is able to work independently and rarely has to contact us with questions. This has helped us achieve our vision of providing high quality, unrushed care while growing our practice. And one of the things that he was a leader in was partnering with us to develop this particular report that works specifically for his business within the organization. And we partnered with Impact PT to customize this report. This helps them to measure, manage, and grow their patient base. However, we could customize this report any which way for you. So if you see something on here that you think would be beneficial to your organization, we can add that into your medical VA report. If you see something you're like, I don't need to know how many EMR filings were done. Okay, we can take that off your report. These reports are fully customizable, HIPAA compliant, and they work directly to show you what's going on within your organization. And being a leader in the industry, knowing the way that he asked us to do it, going the way, he helped us create the report. Showing the way, he left evidence and documentation on our website for you guys. You can go to bbcglobalservices.com and go under the Medical Virtual Assistant tab. And this case study is just readily available. There's no email address required. Don't need to put your information on. Click on it, and you can read all about Matt's story in his case study, showing you the way of how he implemented a medical virtual assistant. I will tell you this in his story. He left the big hospital system and he went out on his own because he cared about patient care. It was very important to him. And he wanted to do things right, and he wanted to do things the right way. And so he went out on his own. And on his own, he found there was a lot of administrative work that had to be done, a lot of back office work. The phone rang off the hook consistently. And so the medical virtual assistant was able to take a lot of that, the insurance verifications. We were able to take a lot of that off of his plate. And his medical virtual assistant today does a lot of that work, and he can focus solely on patient care. And it's had a major impact in his business, so much so that he grew his business and helped us write this case study for him. So he left that piece of information. That's on our website. You just go get it. All right. So here you go. So leaders, show the way. We wanted to show you some awards that we've recently won in the medical virtual assistant, the HIPAA compliance space. Those are there. You also see some team members that we have up on the screen. Also, being leaders in the industry, in the healthcare industry, we attend conferences. So maybe you're going to be attending the APTA events coming up later on this year, or maybe you're attending. Dave Justice and I are going to be in Quebec at the Absorbs event, and that symposium. So if you can stop by a booth when you see us out in the industry, shake hands, say hi, that would be fantastic. Okay. So then the moment of truth comes down to it. That sounds all good and true, but how are the employees? How is my employee going to be treated within your organization? That's a fair question. We want to make sure that you understand that your employees are well treated when they work at BBC Global Services. I could do an entire presentation on the culture of our organization and how the culture of our organization is the way that I would want to be treated. So your employees are treated the way that you would want to be treated. Now, here's what I mean by benefits, though. So in addition to a great culture, which I told you we could talk all about, and if you watch the Healthcare Hiring Blueprint, which was a previous webinar that we did, you'll learn a little bit about that culture. But here's the benefits and how your employees are treated. Number one, they provided health insurance, 12 paid days off, 12 sick days, monthly allowance for travel, internet, interest-free loans. Look, we have a heart for the employees, especially the employees in the Philippines. There is a real challenge in the Philippines with payday loans and some other things, and we provide interest-free loans to the employees in the Philippines to ensure that they don't get caught up in that mess and that they can stay productive at work. We also have employee engagement activities, financial literacy classes, 13 months of pay. Guys, your employees are paid not 12 months. We actually pay them an additional month of pay, just for the great work that they do within the campaigns for you guys. All right, accident reduction program, and a number of other additional trainings that we provide for the organization. We just put one on the screen. Double pay on holidays, different Christmases that we celebrate within the countries, shuttle services, shift meals. So these are all things that make BBC Global Service different, because we provide wonderful benefits for all of your employees. In addition to that, BBC Global is a difference maker in the industry. Again, we decided, just like all leaders, if we're going to do something, we're going to do it right. And so here's what makes us different. There's no setup fees and no long-term contracts. Staffing is out of our offices. Remember, we told you that we feel that that's very important to remain HIPAA compliant. HIPAA compliance certification provided to you. Employee placement guarantee, meaning that if for whatever reason the employee doesn't work out and we have to find you a new employee, there's no additional charge for that. No additional fees beyond the hourly rate. We have offices in India, Philippines, Mexico, Canada, US. We're also staffing experts. What do I mean by staffing experts? We've been doing this for a long time, over 22 years. We have a US-based leadership team and operations staff, which is huge, which forces our organization to remain federally HIPAA compliant, because I guess the right way to say it is that whenever organizations are outside of the country, the federal government has a real hard time enforcing HIPAA regulations in foreign countries. So I'll leave it at that. Again, over 22 years of experience, the internal manager and team lead, which is huge. They're responsible for overseeing your campaign. Assistant with procedure documentation and recording for future reference, and for that manager to ensure that they're following your policies and best practices. I can't tell you how important it is to have not just the employee, but you also have the benefit of the additional team lead that's overseeing that employee in making sure that they're staying on task. We utilize that integrated leadership model, meaning that your employee or staff member works directly for you for your feedback. They attend your company meetings. They participate as you're part of the team. There's no shared services. You're not working with a staff member that's got a shift with you, and they're also answering calls for another organization, and they're also trying to put in data for another organization. This is a dedicated team member. We're doing international recruiting directly for you, and we're providing all the resources and tools to make it work properly. We utilize your current systems, which means we're going to use your ERM system. We're going to use your email addresses. This employee looks like and feels like and sounds like they work just for your organization. In addition to that, we also provide daily reporting. So those are our difference makers. That's what makes BBC Global Services different. Now, oftentimes in a training like this, I teach our team, when they've been through training, they need to do a couple of things. They need to synthesize that information. again, John Maxwell, leadership guru, says that there is oftentimes people will say experience is the best teacher, experience is the best teacher, experience is the best teacher. That's not necessarily true. Think about it. If experience was the best teacher, then every single person that aged would be extremely successful. What John Maxwell says is that evaluated experience is what makes you successful. You have to evaluate the experience. So here's a way you can evaluate your experience. You can figure out what you're going to start doing, stop doing, and continue doing. So I put together some solutions here. What are some things that you can start doing? You can schedule a time within your organization to take your notes, go through your notes, and figure out what you're going to do to implement some of these HIPAA compliance strategies within your organization. Things you're not doing, you should button up, right? What are some things that you should also start doing? Well, if you need a medical virtual assistant, you could schedule a discovery call with a BBC Global outsourcing expert, and they would be happy to have a conversation about the specific role that you would like filled within your organization. What should you stop doing? Well, first and foremost, you can stop stressing and worrying about who you're going to hire and how you're going to hire. You can stop stressing about inefficient hiring practices. Here's the other thing. You can stop asking the question, can I? Can I do this? Leaders don't ask, can I? Leaders ask the question, how can I? How can I? So if you've been wondering, how can you hire a virtual assistant within your organization? I think that a good first step is to book a discovery call with a BBC Global expert. And lastly, what you can do to synthesize this information is decide what you're going to continue doing. Are there things within your organization that you're doing well right now with HIPAA? Evaluate it against this, and that will give you a good learning experience. This will allow you with a medical virtual assistant, guys, if you set up that appointment with a BBC Global specialist and you have that discovery call, then you can continue after that's done and over with, you can continue growing and evolving your healthcare practice. Just like I told you, I would circle back on the conversation. One of the things that we did at that medical device organization with BBC Global is when we had patients that would fall off the funnel, meaning that they needed to be rescheduled and put back on the schedule. Well, a BBC Global specialist outsourcing medical virtual assistant could give that person a call and bring them back on the schedule. How about inbound phone calls that are coming to our practices? They could take those inbound phone calls and they could set those up on the schedule. One of the other things they were able to do is they were able to use our phone system and disposition the calls the proper way so that we could ensure that we could get the data reports that we needed. And they built a custom data report based upon phone calls that we can measure and manage employee performance. They provided us with a team leader. And that team leader was integral in ensuring providing coaching and feedback to those team members. And so I urge you to do the right thing, that if you're looking at a medical virtual assistant, schedule at least the appointment and have the conversation, the discovery conversation with one of our experts on our team. So with that said, are there any questions? Any questions that we need to get answered? You can throw them in the chat. You can throw those questions in the chat if you have them. And we'd be happy, Matt would be happy to answer any questions if you have them. Don't be scared to ask any questions right now. If you feel the need, just throw it in the chat if you have any questions that are left. Matt, I have a question for you while we're waiting to see if anybody else has any questions.
Sure.
So tell me a little bit about HIPAAtraining.com. Tell us a little bit about your organization, what you do, and how you have an impact in the compliance aspect.
Yeah, HIPAA and compliance training has become a big deal. Enforcement is up, instances, breaches are up. We're in a dangerous technology historical place, right? We've been doing this for 20 years. I'm in my 5th year here. And the owner started off as an individual 20 years ago doing HIPAA consultation. And from that little seed, it's the idea of traveling door to door and helping people, which is something I've done in the past, was not scalable. So we have taken HIPAAtraining.com, made it accessible 24/7 online. That's not to say I'm going to answer the phone 24/7, but it does mean that your training, your compliance documents, all those things are always going to be available to you. And then we act as a facilitator, which is to say when you call, you're going to get an automated answering system, but that only lasts for about 5 seconds. You can dial direct, always get a human, or you can wait until somebody picks up the call and just spin the roulette wheel and see who helps you. Though there's product to purchase, we don't sell. We're strictly consultants. We're not interested in upselling products. We're interested in making sure that whenever you speak about us in the future, you didn't say, a little disappointed, they didn't tell me about this, they didn't cover that, they weren't available, it was hard to reach somebody. That goes across all of our products, of course, because we're a unified organization. But we take it humorously seriously. If I can double adverb on you right there. We have rules in the organization that are codified, and they say if a client calls in and needs something and it's a service you can't provide, you can't stop the call until you've either offered to help them find their resource or you've found a resource for them. So that's what we do. It's how we do it. We're going to hold your hand and walk you through your compliance process. We are not a fully automated system where we will put you in and let an AI or a series of automated documents do the work for you. There will be work on both ends, but you will always have access to us. Typically, I'm going to throw that out there as a guarded word, typically at no additional cost. And we absolutely love what we do.
Awesome. Well, I do have to say thank you to you, Matt, from HIPAAtraining.com. Thanks for coming on our webinar, being a resource to the industry and being a leader, really, honestly. I mean, HIPAAtraining.com is a leader. You're a leader, Matt. And all of you that join this call, you now are leaders in the HIPAA space. I advocate to you that you go out and you make these changes in your organization and ensure that not only you're HIPAA compliant, but your partners are HIPAA compliant. And you can ask now good questions. You now know the questions to ask. And so for attending this training, we put together a special bonus offer for you in your practice. And here's what you do. You get out your cell phone, you scan that QR code. We're going to send you a copy of the Med2 method for attending the webinar today, but you scan that QR code and it will take you to a form. On that form, under the section that says, how can we help you? Enter the term webinar. And when you enter the term webinar, one of our outsourcing specialists or experts will give you a quick phone call and set up an appointment, and you'll receive 1 week free of VA services. So if you have your cell phones out, you can scan it, and then it'll pop up a little bar on your screen from your camera icon. You click that bar, it will take you to a form on our website, and then you'll fill out the how can we help you section on that form and type in the word webinar. That will help notify our team that you were attended on our webinar and that you're going to receive 7 free days of service. So I don't know what you could possibly need more information about from a standpoint of HIPAA compliance, but if you have more HIPAA questions, you can reach out to us about HIPAA compliant medical VAs, or you can reach out to Matt. Matt offers his phone number at 512-402-5963. That's 512-402-5963. And Matt's with HIPAAtraining.com, and that will get you to somebody in his office that you can get your questions answered about HIPAA, or you can scan the QR code on your screen right now, fill out the form, enter the word webinar in the how can we help you, and then set up a meeting with one of our business specialists who can help walk you through a medical VA if that's what you've been contemplating. So I appreciate you guys joining us today. We've been going 1 hour and 6 minutes. You're troopers for hanging in there. I appreciate all the information from Matt. Mike, thanks for taking time out of your day to jump on this webinar with all of us. And guys, you have a good afternoon and good weekend. Thanks from BBC Global Services. Thank you for participating and being here. You guys have a good afternoon.